and after creating advance directives. Make sure they feel comfortable with them. Everyone who needs to know should be aware of the documents, including family, friends, spiritual advisors, nursing homes, and hospitals. Also, it's important to make copies and give them to doctors and agents. And the documents must follow the legally correct format.
You know, most people have advance directives that they are asked to fill out right before they go into a hospital, but that's not sufficient because we don't always know in advance when we're going to be going into a hospital, so it's something you want to plan for in advance.
Yeah, my youngest brother, Ike.
Is that, yep, that sure is Ike.
Planning in advance allows Cheryl and Diana to enjoy the time that's left with their dad. It's a process, it's an experience, and an important achievement.
I enjoy my time with Dad. That's the most important thing, is the memories that I'm going to have, because we've talked about things that I didn't know about. We've talked about his childhood. We've talked about the war. We've talked about how he met my mother and how they got married. So I have memories that I'll always have with me even when he's gone.
Are you sure it wasn't Gail?
No, it was you and no Gail. We didn't take Gail anywhere.
Rosemary Pope protects and cares for her brother Cleveland. It's been that way for 21 years.
I just totally care for him because of his condition. And he has a myriad of conditions, mental and physically. And he's a disabled veteran. He was injured in the Korean conflict.
Advance directives for Cleveland became necessary after he was rushed to the emergency room. That happened 4 times.
I was taken aside and I was asked, did he have one in place? And since I am his conservator and guardian, you know, I had that authority to do so.
But it was important for Rosemary to know what Cleveland wanted, so she took an indirect approach to the subject.
So he knows, and I said it with, well, how would you want, if something were to happen to you, and if they had to go, would you want to be on life support like they tried to do Dad? They tried to resuscitate him, but, you know, he didn't respond. He said, yeah, I think so we've had that talk.
Communication is an essential step in protecting your loved one's future and your peace of mind. If it's too difficult to approach these issues directly, look for opportunities to talk about advanced planning. They can include the death of a relative or friend, news reports on illness or funerals, movies or TV shows, a sermon, books or magazine articles, family events like the birth of a child or a reunion. What's important is getting the discussion started.
I don't know what the future holds, but I know who holds the future. So when you look at it from that perspective, everybody would feel at ease, and I feel that everybody will recognize that at least that person had the final say, dying with dignity.
It's the worst-case scenario, a loved one suspended in a medical limbo of feeding tubes and breathing machines.
Sometimes the human nature is to procrastinate on some of these things, and I do, even though it seems like every senior is the obvious person who should have an advance directive, some of them put it off.
And the advance directive allows your healthcare provider to understand what they're allowed to do should you, for example, have a terminal illness and lose mental competency.
It's important to plan ahead before a medical emergency arises. It can involve directives for health care, estate planning, or looking into long-term care facilities.
Well, planning ahead really means looking at all areas: financial, legal, medical, as well as personal areas such as where does the person want to live.
For doctors, treating patients without directives is challenging, especially if the patient can't communicate and the family disagrees on treatment.
Total chaos happens to that patient. If you're a provider, what you're trying to do is discern what would the patient want. If there's conflict, we have a tremendous problem. And what happens in those circumstances usually is we make the decision to make no decision.
And that can be a disaster, financially and emotionally. Advanced planning is the key, even if talking about it is difficult.
In the Asian community, putting out an advance directive is bad luck. It's considered to be bad luck. You're tempting the gods or fate to make you need one. And that's a real challenge that we have to be sensitive to when we talk to patients about this. And we have to make sure that they understand that this is really not tempting fate. It's a way of ensuring that your particular needs are addressed.
Take steps to plan ahead. Organizations like Aging and Independent Services have a wealth of planning materials available. Use legal documents. Estate planning and advance directives are binding insurance for the future. Advocate for your loved one, ask questions, and communicate with health providers.
I can listen to someone's suggestion, and if they call ahead of time and say, hey, I know you're seeing mom today, and she just hasn't done that advanced healthcare directive thing. Do you mind reminding her and suggesting it, and I can take that information to the patient then.
Always look for opportunities to ask your loved one, what do you want if this happens?
This benefits all of us by, number one, from your own personal point of view, respecting your wishes at the most critical moment of your life, the end of it.
The most important thing here is to think about this. It's just a topic that none of us would really like to think about, and we are trying to live in the now. But the best part of living in the now later will be that we did a little planning ahead at some point. These are very emotional topics. They're very difficult because often the people that are the closest are loved ones, and it's difficult to face maybe what's coming. But it's all the more reason to have these conversations earlier. Well, the best place to really start is to call our Aging and Independent Services 800 number. That's 1-800-510-2020. That's staffed by professional social workers who are trained in this area and can kind of walk folks through and refer them to resources in the community that can help. You can also go to our website that's listed on the cover of this DVD and access a lot of the information and forms right there. If we want to remain independent and in control of our lives to the very end, then we have to let our wishes be known. So it's a conversation. You have to jumpstart that conversation. And I guess the thing that we would say is, if people don't want to talk about it, say that, well, the aging experts told us that we really should talk about it. Let's watch this DVD together.